Good evening, my name is Temika Dixon, and I am here to present my informative speech on HIV/AIDS. More than 1.2 million people in the United States are living with HIV infection, and almost 1 in 8 are unaware of their infection. Gay, bisexual, and other men who have sex with men, particularly young Black African Americans, are most seriously affected by HIV. By race, Black African Americans face the most severe burden of HIV. According to the CDC, it is estimated that 1,218,400 persons aged 13 years and older are living with HIV infection, including 1,056,300 who are unaware of their infection. Studies show that over the past decade, the number of people living with HIV has increased, while the annual number of new HIV infection has remained relative unstable. However, the pace of new infection continues at a very high level, particularly among certain groups. The estimated of HIV has remained stable overall in recent years at about 50,000 new HIV infections per year within the overall estimates. However, some groups are affected more than others. MSM continues to bear the greatest burden of HIV infections, and among races and other African American continue to affected in 2013 alone. Estimated 47,352 people were diagnosed with HIV infection in the United States. In the same year, an estimated 26,688 people were diagnosed with AIDS. Overall, an estimated 1,194,039 people in the United States have been diagnosed with AIDS. Also, an estimated 13,712 people with an AIDS diagnosis died in 2012, and approximately 658,507 people in the United States with an AIDS diagnosis have died from the disease alone. The death of persons with an AIDS diagnosis can be due to any cause. Therefore, the death may or may not be related to AIDS. Medical. The disability, chronic illness, of diseases in which I chose for the assignment is acquired insult syndrome, AIDS, which is acquired immunodeficiency syndrome, which is a chronic potential life-threatening condition caused by the human immunodeficiency virus by damaging your immune system. HIV interferes with your body's ability to fight the organism that cause diseases. HIV is a sexually transmitted infection which can also be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding without proper medication. It can take several years before HIV weakens your immune system to the point that you have AIDS. However, there is no cure for AIDS, but there is a medication that can slow the progression of the disease. Those drugs have reduced AIDS death in several developed nations, although HIV continues to disseminate populations in African, Haiti, and parts of Asia. The symptoms of HIV and AIDS tend to vary. Depends on the phase of the actual infection. The majority of people infected with AIDS usually develop a flu-like illness within months or two. After the virus enters the body, the illness, which is also known as primary or acute HIV infection, can last for a couple of weeks. Some of the signs and symptoms include fever, headache, muscle aches and joint pain, rashes, sore throat, and swollen lymph node glands, mainly in the neck. Although the symptoms of primary HIV infection may be mild, the amount of the virus in the bloodstream is particularly high at this time, which can cause infection to spread more effectively. Some people show a present swelling of the lymph nodes, which occurs during clinical HIV. Other than that, there are no specific signs and symptoms, although the HIV remains in the blood and in affected white blood cells. Clinical latent infections usually last around 10 years. If a person is not receiving therapy and decades of taking medication, as the virus continues to multiply and destroy immune cells, a person may develop mild infections and chronic signs and symptoms such as fever, swollen lymph nodes, diarrhea, weight loss, or yeast infection and shingles. As a result of no treatment, after about 10 years, the HIV infection will progress to AIDS. Ooh. By the time AIDS develops, the immune system has been severely damaged, making a person to the infection. The signs of these infections include soaking night, sweating, fever, chronic diarrhea, lesions on the tongue, and weight loss. HIV destroys CD4 cells, which are a specific type of white blood cells that play a large role in helping the blood fight diseases. The immune system weakens as more CD4 cells are killed. Those individuals who are infected with HIV progress to AIDS when their CD4 count falls below 200, or they experience an AIDS defined complication. To become infected with HIV, infected blood or vaginal sections must enter the body. However, a person cannot become infected through ordinary contact, such as hugging, kissing, dancing, or shaking hands with a person who has HIV or AIDS. Nor can it become contracted by air, water, or insect bites. You can become infected with HIV in several ways, including sex, blood infusions, sharing needles during pregnancy or delivery, or through breastfeeding. Thank you, The End.